UZURI presents a Wealth, Health and Alive documentary. Health is one of the basic needs of any citizen, be it young or old. Most citizens end up failing to live healthy lives and also be attacked by long-term illnesses simply because they lack the exact information to be healthy. Community health has been one of the most neglected foundations in the health system, and yet it is one of the basic pillars in the health system. Failure to give this sector attention has been one of the major contributors to such negligence, with formal health carrying the day due to the abilities attached to it and the financial capabilities it runs with. Well, that may not be the story anymore. We did a round check on the streets of Eldoret town to get a view of the citizens on what they understand of community health, simply because we cannot solve a problem we do not know the root cause.
Kwa majina naitwa Margaret Okombo. Mimi ni community health worker hapa Langas. Unajua maana ya community health?
Kwa sasa siwezi nikajua, lakini naweza jaribu.
Tujaribu tu.
Community health at least ni mtu atakuja kwa kijiji ama kwa any community ili asaidie watu kwa njia moja au nyingine.
Community health ni mambo na kuzingatia afya ya binadamu.
Community health venye mimi naelewa ni kuhudumiwa na tuseme community health workers. Kama uko hapa hivi penye mimi niko kama pioneer, sasa wanakuja kukuuliza maswali ama wanakupatia advice na some counseling. Hivyo ndio mimi naelewa.
Okay, community health, what I know about it mostly I deal with people around, and it covers people's their current situation, and when it comes to that, it's somewhere you come with a solution in order to help this person to tackle whatever it is or the problem.
Okay, according to me, there I understand community health is coming up with some solutions that may be affecting some of our people around the place, and giving out what can help them, and maybe advices, something like that.
Anyway, the way that I saw the community is okay. Kwa hivyo mimi siwezi sema sana about community kulingana mimi sio mkaaji wa huko sana. Hata siwezi jua venye iko, labda venye amesema ni hivyo tu.
Penye unatoka kuna facility ya community health?
Ndio.
Sijaiona.
Yes, iko. Najua kenye kuko Pioneer Health Center, kuna CHVs na community health volunteers pia wako huko, na community health workers na some PHOs, public health officers.
Watu wa community health wamewahi kuja kuwahudumia ama kuwaona?
Bado.
Okay, na ungependa wakuje?
Ningependa sana.
Last nikikumbuka walikuja mambo ya net, kupeana net. Na wakatu advice wenye tunafaa kuweka hizo net hivyo.
I can't say but I've seen there are sometimes when kids are being vaccinated, probably I see some health communities workers walking around, but tukisema tu visiting a health facility or talking about health, honestly maybe I also need to be educated on this.
I've met and interacted. Mainly they deal with the girl-child talk. Girl-child talk, and with young mothers, some of that kind.
Yeah, even me, according to me, they have seen their community health actions. They did with young girls and boys, not only young girls, but young girls and boys in addition. Then they also take part in innovating women in general. Yeah, and in some places, they teach people about their health, like HIV/AIDS, something like that. Then they give girls the role of how they can put up themselves.
Hii afya yako iko aje? Unaweza sema iko namna gani kwa sasa?
Kwa sasa afya yangu iko sawa.
Najielewa vizuri sana, mimi nasikia niko chonjo.
Okay.
Kwa vyovyote.
So afya yako iko sawa?
Afya yangu iko sawa, mimi najielewa kwa vyovyote na niko salama na niko na uzima.
Sikwangi mgonjwa kirahisi.
Na kwa saa hii afya yako iko namna gani?
Sijui hata. Lakini
For now, I'm feeling healthy. I thank God. Yes.
Sai, I feel I'm healthy, I'm alive, and I'm good. Yeah.
Yeah, I'm also sure that I'm good. Yeah.
Sasa ni mnapanga ni lini tena mtarudi kujiangalia kwa hospitalini?
Okay, we usually do it occasionally. Times maybe kama umekuja hizo how do you say, outreach. Yeah, they do come, but with me, I usually do it anytime I feel like, yeah.
Okay, and you?
Yeah, also me, I'll go soon. Yeah.
Kwangu hata naweza enda leo jioni.
It is quite evident that the people have some information, but also not underlying the fact that none of them is very correct. To tackle that, we have a professional, a great man in this field of community health who will help us in shedding light to community health and also give us information about their organization. This is on the pursuit to ensure that as a citizen, you get understanding on community health from a different perspective. Kwa manufaa ya watazamaji wetu, tafadhali jitambulishe.
Kwanza kabisa ningependa kuanza na majina. Mimi naitwa Agri Ogendo, mkaaji wa kaunti la Uasin Gishu na founder organization ambayo inaitwa Ogendo's Grange. Under Ogendo's Grange we have a project that we are working on ambayo inajiita UZURI. UZURI is a portal that is onboarding, or rather we are creating a network of community health workers. Under that we are creating a directory of specialist hospital and doctors. So each will have a profile indicating where they are, where they are located and their phone numbers.
Naam, tueleze kuhusu afya ya jamii na pia uchambue nani ni mfanyikazi wa afya ya jamii.
So community health has different definition. World Health Organization has its own definition, and other global organizations, they define community health differently. But for our sake as UZURI, we say community health is a total sum of environmental, social and economic well-being of a given community. Now, who is a community health worker? A community health worker is an individual who undertakes these three items that I've shared. That is the environmental, social and economic well-being of a certain community. They work specifically to address issues pertaining health in their locality.
Ni kitu kipi kinafanya afya ya jamii kuwa tofauti kwa afya ya umma?
When we talk about community health in relation to public health, first, under it kuna social workers, kuna public health officers, kuna community health workers as profession, wale ambao wameenda shuleni, na pia tunao psychologists and other professions. These are professions that are found under community health. As much as it is a different profession, that it's a standalone profession, it houses other professionals. While public health is a profession on its own, and you'll find that public health officers are found in the hospitals, whereas a community health worker is found within a community. The work of a public health officer is to wait for the information that is gathered from the health center and to see how they can relate to that information so that they can help the community either to do behavioral change or any other kind of preventive services. Whereas a community health worker understands the system, because it's the responsibility of a community health workers to understand how a patient will move from the village to the hospital. So that is infrastructure, one point. And when we talk about infrastructure, kuna mabarabara na vile mgonjwa atafika hospitalini. That is one aspect of a community health worker. Pia delivery of products and services. These are the things that a public health officer huwa wafanyi. Lakini ukiangalia community health worker will deliver nets, will make sure the vaccination are given, and they'll know their patient as per their location. That is per house. They do house-to-house visit. They offer psychosocial support and any other kind of support that a public health officer is not able to provide.
Uzuri ni nini na mnapigania nini haswa?
Uzuri is a platform. We are creating an ecosystem where community health workers, together with other health professionals, they can interact without any intimidation or superiority. From doctors, the least who is a community health worker. So as a platform, we have community health workers, we have doctors, and the facilities that these people will, or rather they are working on. Hiyo tu ndio msingi ama jukwaa ambayo tunaunda ambayo inaitwa Uzuri, of which unaweza ipata katika mtandao. Ukiangalia katika www.uzuri.or.ke. Hapo a community health worker anaweza enda akajiregister na akaweza kuwa among the team, or rather this course. Tuko na 4 core mandates that tunasimamia. Kwanza tunasema kuwa community health worker lazima akuwe employed, aandikwe kazi na serikali. Hiyo ndio one of the things that we are advocating for. 2, tunasema a community health worker ni lazima apewe personal protective equipments, because ukiangalia in the country, most of our community health workers, they work without these important equipments. Na tumetoka tu hivi juzi tumekuwa tukiona maneno ya corona. Kama ni community health worker ambaye anaenda kuhudumia mtu ambaye ako na ugonjwa kama corona na hajajikinga kwa njia yoyote, kuna uwezekano a community health worker kuwe carrier ama atumike kusambaza ugonjwa, na tunajua kuwa kazi yao ni kuzuia ama kuprevent more infection. So that is number 2. 3, tunasema we need to increase the uptake of national social insurance, that is health insurance. So kazi yetu kama community, kama Uzuri, tunafanya kazi na wale community health worker individuals ambayo wako katika jamii, ili waweze kuhamasisha wengine waweze kuchukua hizi kadi, maana zitawasaidia. Pia tunasema as a community health worker ni muhimu yeye pia apewe health cover. So hiyo inakuwa package, because akishakuwa employed na government atakuwa well remunerated, na hiyo itamfaa, ataweza kuwa na means ya kupata insurance. Ya 4, nasema kuwa watu are advocating for health literacy and awareness. It is our responsibility as a platform to create that awareness to the public. At the same time, we are offering that health literacy among ourselves. Kuna forums ambaye tutakuwa tunaunda where community health workers watakuwa wanafunzwa, wanapata specialized training, so that when they are dispatched in the community, they can offer the services that are best suited depending on the needs of that particular community.
Ni suluhisho zipi ambazo mmepeana kwa jamii kwa jumla?
Tasema number one, we are giving happiness to the community. I know you are wondering how as a platform can give happiness to a community. One, we are saying that a healthy person should be happy. And where we are standing, we are not here to point the challenges that the community is facing, rather we are here to create solutions. So we are saying we want to celebrate the gains that we have and have a future that is hopeful. So our work is to create that and to share with other health professionals that yes, despite the challenges that we are going through, we need to enjoy and have peace and happiness in whatever that we are doing. Jambo lingine, solution ambayo tunapeana katika jamii ni kwamba we are creating efficiency, accountability within the health industry. Because a community health worker needs to be accountable to the health facility and the community that they are working in. And when they are doing that, they need to create that efficiency so that we get services as quickly as possible. Another thing, nasema kuwa as a platform, we have creating products and is a tool in its own, because we have already created the platform which we are currently onboarding health professionals. Second, we are creating products that are going to be used by these community health workers.
Na kwa vile ni shirika la kujumuika na wanajamii, mnapanga vipi kuifanya iwe ya manufaa kwa wote?
As a social enterprise, we are creating products and services that are going to enable us to enable us to be sustainable. Because the goal of any organization is to sustain itself from well-wishers or donors. So our work here today, as we are creating this platform, I believe that it is going to be a continuous production that is going to help us to raise the profile of the organization, as well as to raise the resources that we are going to plant back into the organization for it to be sustainable. This production, as it is being recorded, tunasema kuwa ni tunaita ama ni health, wealth and alive. Why do we call it health, wealth and alive? Number one, when we talk about health, I know one thing, ile jambo la kwanza ambayo itakuja kwa akili yako ama kwa yule mtazamaji ni kuwa ni hospitali. Lakini from the perspective of UZURI, health is the system. And when we talk about the system, this is now the organization of the people, the organization of the institution that we have that are working towards ensuring we get health services. And third is the resources that we have as a nation. So when we talk about health, those are the things that we are going to capture from our perspective, a community health perspective. So health is the system, and the system is the organization of the people, organization of the institution, and the resources that we have. Number two, we are saying wealth. When we talk about wealth, I know there is a famous saying that says health is wealth. But now for us, we are saying wealth is related to the cost that we incur as a nation towards health. So when we talk about cost, we have interest, we have affordability and accessibility of health services. Interest is not necessarily profit, because I know the goal of any private health facility, their goal is to make profit for them to be sustainable. But there are many other interests that come into health more than the profit that we get. So those are the interests that we are going to look into and to understand and to have a deeper perspective of them. And we make sure that the services that are being provided by our private institution are affordable to a common mwananchi, because it does not make sense to have a private facility in the country and the locals are not able to get these services. Even if it's a public institution, Because I know for the public institution there is a cost sharing, but for the private institution, they have to make a profit. So we have to make sure that whatever pricing they're doing, it must be affordable to common mwananchi. And the third is accessible. These services is, let me talk about cancer, for example. We know that cancer is a very expensive disease to treat. And the services in the country, some are accessible, but they are not affordable. And those that are affordable, they are not accessible. The third bit of it, we are saying alive. For us to be healthy, we need to be alive. Because, of course, it's common sense. For you to be alive, you must fight for your health. So we are not just, we are looking at the surveillance of our situation. And when we talk about surveillance, we are saying that we are going to have a continuous collection of health data, and this data is going to be analyzed. And after analyzation, then it will be interpreted. And once it is interpreted, it's one way for us as an organization to offer that valuable service to the county government and the national government, because it is through the information that we can customize our solution. It's through this information that we can know how best we can help our health professionals, be it a community health worker, be it a doctor, be it a nurse, but anybody who is under health practice can gain or benefit from this kind of information. Because we say in UZURI that when you have UZURI, tunasema UZURI niko nayo. The part of niko nayo inamaanisha our work or our objective is to make sure wherever you are, in your home, in your community, the information that you give us will come back to you as a solution.
Na kufikia sasa ni changamoto zipi ambazo mmepitia kama UZURI?
UZURI is not an exception from other social enterprises in the country and other businesses for that matter, because hizo challenge zipo, na mojawapo tutasema ni capital, because it's very hard for a social enterprise to sell its vision to those who are supposed to buy into it. And it's something that you cannot sell to a financial institution to back it up. So challenge number one tutasema ni to raise resources so that we can make our work, or rather the business that we are in, viable enough. But we understand from a community perspective, then there is that chance for us to grow and to get to another level. But number one of the challenge is resources. Number two, there is an assumption that when you are doing a community work, then you must have some reserve somewhere, let's say from donors or somewhere. But as an organization, we are not dependent to donation, but we are saying we have that ability to make our community health workers be able to engage themselves in economic activities that are able to generate resources rather than depending on well wishes. So it is a challenge. At the same time, it is an opportunity that we want to look at it from an advantage point rather than a disadvantage, and to bring those who see the potential in social entrepreneurship, especially in the Kenyan setup, that they can transform these lives within the localities so that we can be productive people of the society.
Na kwa sasa ni kiwango kipi nyinyi kama UZURI mmefaulu kufikia?
Now, the milestone as an organization as UZURI ambayo tumeweza kupata, tasema kwanza we create this platform. Tunaita like a minimum viable prototype. Hii platform ambayo tumecreate uzuri.or.ke is our first milestone, because saizi tunaweza onboard community health workers, Advantage ni kwamba a community health worker can register him or herself on our platform free of charge. We don't charge anything. So the more we have, the better. So hiyo ni one of the greatest milestones that we have achieved so far. Two, tasema kwa kufanya this recording, because tuko natumaini kuwa it is an ongoing project, na tutakuwa tuna create series. Now this series is going to offer health literacy amongst our people. It's going to highlight the advantages that we are gaining as a community, as health practitioners in general, be it doctors, be it nurses, be it clinical officers, be it social workers who are in health industry, and last of them all, community health workers. They are going to benefit from it. So as a platform, those are the milestones we are celebrating today. And the last of them all, nasema kuwa vile nilikuwa nimesema awali, we are still doing some research and developing products and tools that they are going to empower this group of people.
Je, kuna kesho iliyo bora kwa afya ya jamii nchini Kenya?
Yeah, the future of community health workers is there and is very alive and is very vibrant. Kwanza nitasema Kenya kama nchi ambayo inapatikana Afrika, tunaenda tukikua katika hali yetu ya uchumi. So economic wise, the continent and the country is improving. And the more we have disposable income, the more people will demand customized health care. And from that angle, we are going to enjoy home nursing or rather home care from our health professionals. As a platform, we are saying we are building something for the future. We are building a platform for the future. Today you may not see or make sense of UZURI as a platform, but I believe 10 years from now, a community health worker in the village where they can receive a call from somebody who's very active economically to take care of their ailing relative back at home. You don't need to waste time leaving your work to go home to take care of your ailing relative. But a phone call away, you can call a community health worker and they can give professionalized services. So yes, there is future and there is a great future for community health. Another thing before I close, I say as an organization, we are trying to bring a cure or preventing what we call absenteeism and presenteeism in our places of work. What do I mean by saying absenteeism? Because when I'm ill, that means I'm not able to perform my economic duties. So that means there is loss in the production sector. If it's a factory, if it is wherever I'm working, there is that reduction in output. So having a community health worker will be able to attend to my needs wherever I am, be it in workplace or in the village or at home. There is somebody who's there to take care of my needs. Presenteeism, that is the second aspect that we are trying to prevent. That means I may be sick and I've already reported to work. Or rather, I have a sick person in the village and my attention is divided either in work or in office and to attend to this health, a person who needs my attention. So having a community health worker will give me that will free me mentally, that is, to concentrate on my economic duties, whereas there is somebody who attends to my sick relative. There is no loss in production hours, there is no loss in our mental health. So we are building a holistic community that we say we don't need only to focus on ailments that are affecting our bodies, but we can say even mental health is one of the biggest objectives of our organization, because you have to be mentally fit for you to be productive. So yes, we are bringing this and we are impacting positively the industry, and we are saying there is a great future for community health workers. As we conclude, ningependa tu kusema yale yote ambayo tumeweza kushiriki uweze kukumbuka. Everything that I've shared, I want you to remember and to remind our target audience, that is the community health workers, to register on our platform. It's free of charge. We don't charge anything, but we believe the more we are, we can able to engage further. It is the reason, or rather it will give us more reason to allocate you from your county so that we can create these forums to discuss the challenges and way forward on how we can improve our lives and work together with the county and national government. Again, I would like to say we have social media sites. You can go like, share, subscribe. All in all, social media platform you can get us. Our handle is at UZURI Community. That is, we are on Facebook, we are on Twitter, we are on Instagram, and we are on LinkedIn. And you can find this footage on YouTube. We urge you that you can share with your network of friends so that they can know what we are doing. And this is the first of many productions that we are going to do. We are going to visit hospitals, we are going to visit communities, we are going to visit all people who are giving us health services within our country so that we can have a community health perspective.
According to the World Bank, in the year 2018, the population of Kenya as a country is 49,699,862 as per the year of 2017. According to it also, the per capita income of the country is $3,250. The life expectancy at birth is 69 for the female and 65 for the male. Infant mortality rate is at 36 as per 1,000 live births. According to the GBD Compare in the year 2019 in Kenya, top 10 causes of death include HIV and AIDS, lower respiratory infections, diarrheal diseases, neonatal disorders, tuberculosis, ischemic heart disease, stroke, cirrhosis, diabetes, and congenital defects. That is brought to you courtesy of UZURI.or.ke.